Hi friends, welcome to my channel. So this is my first video which I am posting. So my videos would be related to the nursing aspects and all the other things that are mainly important from the nursing point of view. So if you do like these videos, please hit the subscribe button and press the bell icon for any quick notifications, and please do subscribe my channel. So today we will be seeing one of the important topics related to the mechanical ventilator. So I will be making videos related to the mechanical ventilator about different modes, what are the other things that are there. So I will be making a separate video on that. But today we will be seeing the care aspect, how to take care of a patient who is on a mechanical ventilator. So let's begin. So, coming to the definition, before going to the care aspect, let's see what do you mean by mechanical ventilation. So, it is a type of therapy which is mainly given to the patients who are not able to breathe by themselves. Okay, this is an artificial means by which the patient is given breath uh, from outside. So, when he is not able to take breathe on his own, his or her own. So it can either be positive or negative pressure type can be there. So nowadays we are not using negative pressure types of ventilator. We are mostly using positive pressure ventilation. So coming to the indications, in which all cases mechanical ventilator might be required. So like in cases of acute respiratory failure. Okay, acute ventilatory failure. So when the patient is not able to ventilate, so there are two terms that you have to know, that is ventilation and another one is oxygenation. Okay, ventilation means we want the patient to ventilate. Ventilate means moving in and out of the air. Okay, that is the inspiration and expiration. So if the ventilatory support means if the patient is not able to ventilate, if the patient is not able to expire the CO2 out of the body, so what will happen? There will be CO2 accumulation will be there. So CO2 increase will occur and the pH will decrease. Okay, it mainly the ventilatory failure, this mainly depends upon the expiration part, whereas the oxygenation mainly depends upon the inspiratory part. Okay, what we are inhaling, how much oxygen we are taking, so that is the oxygenation. Ventilation means the expiratory part, means how much we are expiring, how much CO2 we are eliminating, that depends upon the ventilation. So if the in acute ventilatory failure, so the pH will decrease and the CO2 retention will be there. Severe hypoxemia, when oxygen levels are very low in the blood, so saturation is less than 75 or PaO2 levels are less than 40 mm of Hg, so partial pressure of oxygen, and this is the saturation of oxygen, both are less. Then impending ventilatory failure. So in impending ventilatory failure means, suppose the patient you are seeing, so he is going to progress, means one or two ABGs you have done and you are seeing that there is a significant acidosis is there, means now you did an ABG, then again after next again when you did an ABG you saw that the acidosis is increasing and increasing. So that might be because of the hypoventilation. Okay, so pH less than 7.3 or PCO2 will be rising. So in those cases, we mainly, if a patient presents to the emergency room with means the GCS is okay, but we are while monitoring the patient, we are seeing that the patient is moving to more and more towards the acidotic state. We mainly ventilate the patient, even if it is means afterwards the patient might have problems. So in order to save the patient, we have to intubate the patient and keep his or her in a ventilator support. Prophylactic ventilatory support, when a patient has surgery or something, so for post anesthetic recovery we mainly need to keep a patient in a ventilator. Then prophylactic ventilatory support is mainly given for reducing the risk of any pulmonary complications like prolonged shock, head injury, smoke inhalation. Okay, So these are for reducing the risk of pulmonary complication. Reduced hypoxia of major body organs like hypoxic brain or hypoxia of heart muscles we need to avoid. In those cases also we need to use. Then cardiopulmonary stress, to reduce the cardiopulmonary stress like prolonged shock, CABG surgeries and other thoracic and abdominal surgeries. For that also, if ventilatory support is required, we need to give it. So coming to the basic parts about the ventilator, then we will look about the care aspect. So you might have seen these ventilators in the emergency room or in the ICUs, mainly in the ICUs you might have seen, because there mainly serious patients are there. So this is the ventilatory monitor. Okay, so based upon the different companies that are manufacturing this ventilator, so monitor might be different. So these are the ports. So these are the ports of the flow sensors. These are the ports of ventilatory ports are there. One is for inspiration, another one is for the expiration. Okay, flow sensor, I will show you what is flow sensor. Flow sensor is a device by which means in every ventilator flow sensor is not required, but in some ventilators flow sensors might be required. So this flow sensors helps to monitor the patient's, all the parameters can be monitored for when it is connected to the patient. Then this is the central oxygen supply. So this white pipe that you are seeing, so this pipe is disconnected to the central oxygen. Okay, from here the oxygen comes to the ventilator and it is delivered to the patient. This is the bacteria filter and HME unit, that is HME filter. So as we know, in a normal person, nose is our main sense organ, which helps in the inspiration and expiration. Okay, so it not only helps in that, but also the air that we are taking it helps to moisturize that air and also prevent any bacterial or germ entry or any dust entry is prevented. So that same thing in a ventilator, it is done by the heat and moisture exchange. So whatever the patient breathes, means when the patient will breathe in, it will deliver the breath. When the patient expires, whatever in the expired air, whatever the moisture is present, so it gets trapped. So when the next breath comes, so it will add some moisture in that and it will give to the patient. As well as it also helps to filter the bacteria, any bacteria or any dust is there, so that can also be trapped in that. And this HME filter needs to be changed every 24 hours. This is the this is the ventilatory circuit. In some of the ventilatory circuit, this water trap might be there. So the water vapor might get collected here and it can get collected in this water trap. Okay, and which can be later on discarded. So in all ventilators it's not present. Some of the ventilators it might be there. This is the catheter mount. Okay, so here the patient will have the ET tube, and to which the catheter mount will be connected. So it helps as an extension. Okay, it helps as an extension for the ventilator, so that we can fix the position of the ventilator. So it is a corrugated tube. Okay, you will see the ventilatory tube are also corrugated. This catheter mount is also corrugated. So this corrugated tube, one benefit is it helps to means flex. It is flexible. Okay, you can change the position. It is not stiff, and also it helps to increase the volume of the ventilator tube, as well as the in that catheter mount also the amount of air that is going to the lungs. So that also increases. So catheter and also the expansion and contraction that can also take place. So this is the catheter mount and this is the HME filter. Okay, so this catheter mount is there, then HME filter. After that if after that the ventilatory tubing is present. In some of the ventilators, if flow sensor is required, so the flow sensor will be placed here. Okay, the flow sensor, then the HME filter, and then this ventilatory tubing would be present. So this is the flow sensor which will be monitoring the parameters. In all ventilators it is not required. So here you can see HME unit, your catheter mount would be there, HME unit, and then the ventilatory tubing. So you see the expired, so it is trapping the moisture and the heat in it, and when the again the next breath will come, it will means add in that heat and moisture and deliver it to the patient, because cool and dry gas will means irritate the airway. So this HMA filter is used. And here some gas, means if extra gas oxygen has to be given, so it can also be given through this port, or any monitoring like EtCO2 monitoring can also be done through this port. Here coming to the now coming to the nursing care of patient on ventilator. So we have seen about superficially about the ventilator, the modes, how the modes are there, about the normal physiology of respiration, the types of ventilators. Okay, so now we will see the nursing care of patient on ventilator. So if a patient is in a condition where he or she needs to be intubated emergently, so ventilation equipment and supplies, all these things should be ready. In some of the wards or ICUs, there is separate intubation trolley which is present, in which all the intubation items that are required is kept, so that it should be hassle free. So while if a patient is emergently, if the patient needs to be intubated, then we have all the supplies in our hand, and means the it should not delay. There should not be any kind of delay in while doing an intubation. So an important aspect of being prepared for any patient requiring mechanical ventilator is to regularly review the number, function, consumables which are used, single-use circuits, humidifier chambers, and also assigning staff members who would be involved in the ventilator. So before each shift, there should be um, like assignment, means that if a patient means there should be an assignment that the intubation trolley should be checked by them, checked by the staffs. Like we are checking the crash trolley, the narcotics in our ICUs or in the emergency room. Same way, an intubation trolley, uh, then all these things should be assigned to one staff who would be checking everything. I mean, the sterility and the functioning of the items should be checked. Then bedside nursing care supplies, all these things should be there while performing the intubation, and of all the drugs which are there, that should also be kept in the intubation trolley, which need to be there in while intubation, all the sedation, analgesics, whatever is required. And all the medications which are being used, they should be labeled. Okay, they should be labeled so that any medication error can be prevented. So what are the supplies like for airway bag, valve, mask, ventilation? For emergency ventilation bag and mask, bag, valve, mask should be ready. Sterile endotracheal tubes should be there based upon the if it is an adult, 7 8, 6.5, 7, 8, like this it will be required. A child, pediatric clients, for them, so based upon the pop age, the endotracheal tube should be kept. The laryngoscope should be kept, like different types of laryngoscope are there, Macintosh, Miller laryngoscope. So Macintosh is mainly used in case of adults. So based on that, various sizes are there. So and also their functioning should also need to be checked. The whether the light in the laryngoscope, whether it is fitting well or not, everything should be checked. Then tube ties. Okay, for the tube tying the endotracheal tube, so there should be tube ties should be made ready. ET cuff manometer should be there to check the pressure of the cuff. Replacement tracheostomy tubes or liners if a patient needs a tracheostomy immediately, so all these things should be ready. And suctioning items which are there. So this is the bag and mask that should be kept ready. It is present in the crash cart, but one bag and mask should also be kept in the intubation trolley, so based upon the protocol of the institute. Then laryngoscope. So Miller laryngoscope is mainly used for pediatric clients, whereas Macintosh is mainly used for the adults. So their functioning should be checked, and here you can see there is a light here present. So in order to while inserting, so they can see the airway, means the epiglottis and or the airway can be seen, so that the insertion can be present. Then this is the Bain circuit. So sometimes what happens, the bag and mask may not be have give may not give a proper ventilation to the patient. So in that case, in order to, when the respiratory demands of the patient are high and we need to change the ET tube or we need to intubate the patient, in that case we use the Bain circuit. In the Bain circuit, what happens, more amount of air can be delivered to the patient, means a positive pressure type of ventilation can be given to the patient before intubation. So before intubation, we need to pre-oxygenate the patient. So we can oxygenate him or her by bag and mask or through the Bain circuit. So in the Bain circuit, you can see this is the reservoir bag, this is the corrugated tube, and inside it again this green color tube you are seeing the inside. So that is a tube that means delivers fresh air to the patient, and this is the tubing. So this end is cut and it is connected to the central oxygen supply. Okay, through this fresh air would be coming in and it will be delivered to the patient, and whatever expired air from the patient will be collected here. Okay, and this collected air would be means compressed, should be compressed, so that it will help to deliver extra, the exhaled gases would be delivered along with the fresh air, and this will help to push the fresh air into the lungs. So therefore this also indicates that whether the patient's breathing is proper or not. Okay, so while ventilating, this should also be pressed so that all the airs should be delivered to the patient. So this Bain circuit is mainly used in anesthesia, but in case of the patient, ventilating the patient in the ICUs or in the emergency room, also Bain circuit can be used. Next, anesthetic supplies, all the sedation and induction drugs, then emergency drug doses should be calculated and kept. Patient hygiene supplies like oral care supplies, sponge, forceps, sterile gauge, saline flush, kidney tray, and chlorhexidine mouthwash, eye lubricant. All these are the patient hygiene. Means after intubation, what all things, suctioning items which are required. So that should also be kept there. Caregiver supplies like PP, sterile gloves, hand sanitizer, all these things should be kept. So intubation is a sterile procedure. So always keep sterile gloves, sterile gloves in the intubation trolley. Hand sanitizers, all these things should be kept. Syringes, okay. Then ventilator supplies like the ventilator tubes, CO2 cuvettes, the ETCO2 uh, sensors which are there, flow sensors, inspiratory expiratory valves, patient filters, means HME filters, or track vent, means in tracheostomy also a type of HME filter is used, so that is known as thermovent, sorry. And sterile water for humidifier. Some of the ventilators you might have a humidifier, in that inbuilt humidifier might be there. So in that sterile water has to be given. So based upon your ventilator supply in your ICUs in your hospital, the supply, I means all this ventilator supply should be kept ready. So before intubating, means hand hygiene, means if it is a planned intubation, then it is okay, you can do the hand hygiene and all. But if it is an emergency intubation, you can quickly do the hand rub and wear sterile gloves and do the intubation procedure. So hand hygiene is most important because it helps to prevent the hospital acquired infection and all other infections like VAP, COT, eclampsia, okay, or catheter related bloodstream infection, and it helps to prevent the outbreak of multi-drug resistant bacteria. As we know, hospital is a hub of bacterias, viruses. Okay, so this helps in preventing the transfer of bacteria. Okay, breaking the cycle of this transmission is mainly done by the hand hygiene. Okay, and also, and it should not be you should not think that if you're wearing gloves then you need not to do the hand hygiene. It is not. Hand hygiene is most important. You wear or don't wear your gloves, hand hygiene should be done.